Welcome to this quick start video on Medicare Q&A. Common questions or statements about chiropractors and Medicare billing. In this video, we will go over common questions and statements that we hear from chiropractors about their relationship with Medicare, Medicare eligible patients, and Medicare billing. The answers to these questions and statements came from multiple Medicare training sources. One was the Medicare Learning Network, which is a division of the Centers for Medicare and Medicaid Services, and they wrote the MLN article SE0749, which answers a lot of the common misconceptions about chiropractors and Medicare. Also, the answers to these questions or statements came from various Medicare contractor websites. One was the National Government Services Medicare Contractor website. Another was WPS Government Health Administrators Medicare Contractor website. Here is an example of the Medicare Learning Network MLN article, SE0749. So, common statement: I don't do Medicare, I opted out of Medicare. We hear that a lot from chiropractors. The answer is, according to Medicare, chiropractors are not eligible provider types to opt out of Medicare. Medicare has a list of provider types that are eligible to opt out, but chiropractors are not listed. Chiropractors cannot opt out of Medicare. Chiropractors may decide to be participating or non-participating in Medicare. That is their participation status with Medicare, but they may not opt out. What opt-out means is it refers to a physician's ability to decide not to bill Medicare at all and then enter into a private contract, or basically cash pricing, that's what we call it in the chiropractic world, with Medicare beneficiaries they treat. There are other provider types that are eligible to opt out of Medicare, but chiropractors are not eligible to opt out of Medicare. To find out more on this, you can refer to a section on the NGS Medicare site that is called Providers Not Eligible to Opt Out and Enter into Private Contracts. And you'll see chiropractors right on there. Or you can look on the WPS Medicare site in a section called Enrolling in Medicare to Submit or Not Submit a Claim. Also on the MLN article SE0749, misinformation number 4 goes over this section in detail. Another common statement: I'm an all-cash practice. I do cash plans for my patients that are 65 or older, or I just have them pay cash for manipulation. According to Medicare, if you as a chiropractor do not enroll in Medicare at all, you are not eligible to bill Medicare-aged patients. So any type of Medicare beneficiary, which would be someone 65 or older, or there are other types of patients that have Medicare, usually some patients on disability, etc. So you are not, as a chiropractor, eligible to bill a Medicare-aged patient for any Medicare-covered service, which is spinal manipulation for acute subluxation. So if you do not enroll in Medicare as a chiropractor, you're not eligible to bill Medicare-aged patients for any Medicare-covered service, which would be spinal manipulation for acute subluxation. So according to Medicare, if you are not enrolled in Medicare and you bill a patient that is 65 years or older, or any Medicare beneficiary for spinal manipulation for acute subluxation, you are in violation of federal laws and could be subject to legal action. And that's taken straight from the Medicare site. You can go to the WPS Medicare site and look in the section called Enrolling in Medicare to Submit or Not Submit a Claim. You can refer to the Furnish for Free Medicare Covered Services section of that page. Another common question: so I can't opt out of Medicare as a chiropractor. What relationship do I have to have with Medicare? The answer, if you as a chiropractor want to treat a Medicare beneficiary, then you need to be enrolled in Medicare, either as a participating provider or a non-participating provider. A common statement: I am non-participating with Medicare, so I don't have to worry about billing Medicare. Some chiropractors think that if they're non-participating with Medicare, they can leave Medicare out of the picture. The answer, being non-participating with Medicare does not mean you don't have to bill Medicare. All Medicare Part B covered services, which are spinal manipulations for acute injury, must be billed to Medicare by the chiropractor, or the chiropractor could face penalties. And that comes straight from the Medicare Learning Network MLN article SE0749 in the misinformation number 2 section. Another common statement: I chose to be a non-participating, non-par Medicare provider so that I don't ever get audited. The answer, any Medicare claim submitted can be audited or reviewed. The participation status of the physician, either participating or non-participating, does not affect the possibility of an audit occurring. So if you're not participating, that doesn't give you any benefit of not getting audited as often. The participation status is not what Medicare auditors are looking for in terms of if they are going to request records and audit a clinic. Chiropractic care has documentation requirements to show medical necessity with Medicare, and the participating status of the provider is irrelevant to the documentation requirements. The documentation requirements are the same if you're participating or non-participating with Medicare. You can refer to sections 3 and 7 of the MLN article SE0749. A common question: so what is the difference between being a participating provider or a non-participating Medicare provider? The answer, if a chiropractor is enrolled with Medicare as a participating provider, the chiropractor has to bill to Medicare. Medicare pays the chiropractor directly, and also Medicare will pay a higher amount for spinal manipulations to participating providers compared to non-participating providers, normally 5% or so higher. If a chiropractor chooses to be enrolled as a non-participating provider accepting assignment, the chiropractor has to bill to Medicare. Medicare pays the chiropractor directly if the non-participating provider is accepting assignment, but Medicare pays a lower amount to a non-participating provider. So basically, if you're non-participating, accepting assignment is the exact same thing as being participating, except you get paid 5% lower. Okay, if a chiropractor is enrolled as a non-participating provider not accepting assignment, the chiropractor has to bill to Medicare. So as you see, regardless of your participation status, all three options here, the chiropractor has to bill to Medicare for spinal manipulation for acute injury. If you are non-participating, not accepting assignment, the patient pays the chiropractor directly. Medicare reimburses the patient instead of the chiropractor, and Medicare reimburses a lower amount since the provider is non-participating. We personally recommend clinics to be participating providers with Medicare for many reasons. Of course, it is always up to each clinic to make that decision, but here are some things to think about when making this decision. One reason that we recommend clinics to be participating providers is that the chiropractor gets paid more. It's pretty simple. Your documentation requirements are the same if you're participating or non-participating. Your billing is the same. Your billing requirements are the same, but if you're participating, you get paid more. It doesn't take a rocket scientist. Another reason is patients like it that they don't have to pay much or anything to the clinic for a spinal manipulation, depending if they have good secondary insurance or not. So if you are a participating provider, if the patient only has Medicare, they just have to pay a 20% coinsurance, which is usually around $8 for a 98941 spinal manipulation for acute treatment. If they do have a good secondary insurance that covers that $8 coinsurance, then they don't have to pay anything at all. Medicare patients like that. They like that relationship with a chiropractor. Now, of course, if they are switching to maintenance care, then they will most likely have to pay. And that is a separate video based on the Medicare ABN form. Another reason that we recommend clinics to be participating providers is that if you are non-participating and you're not accepting assignment, if there are any billing issues that occur, the patient doesn't get reimbursed from Medicare. So if the doctor chooses a wrong diagnosis and Medicare does not cover it, and it's contractual because the doctor didn't choose a correct diagnosis, then the patient doesn't get reimbursed. So they get their EOB from Medicare and they expect their payment from Medicare because the patient already paid the clinic and there's no check there. And so then they call Medicare and the patient is already mad because they had to be on hold with Medicare for 45 minutes, and they ask Medicare, "Why didn't you pay me?" And Medicare says, "We didn't pay you because the doctor did not choose an eligible or a correct diagnosis." So then the patient is like, "What in the world? I paid the doctor and he didn't do a correct diagnosis. I had to be on hold with Medicare for 45 minutes. So then they call your clinic and your lovely front desk staff gets a call from a very unhappy Medicare patient and says, "Medicare says it's the doctor's fault that I didn't get my check." So then the clinic looks bad, and it is possible then we will work with the chiropractor and try to get the correct diagnosis and get it rebilled. But it just puts the clinic in a bad position with the patient. Another issue that occurs, and we have seen it, is when a chiropractor is non-participating and not accepting assignment, is when that same issue occurs, you have a billing issue occur and Medicare doesn't pay, and then the patient has also a Medicare supplement plan. And if there's any kind of billing issue, then the Medicare supplement plan also does not reimburse the patient. And on a billing side, if the chiropractor is not participating, the secondary insurances will not release hardly any information to us as a billing service about if they paid or did not pay the patient, because it is a non-participating, non-accepting assignment claim, and they pay directly to the patient and they work directly with the patient on the claim. And so they will not give us a lot of information, and it is more difficult for us to work with them to get a claim paid if the chiropractor is non-participating. So again, the clinic is in a bad position with the patient because the patient is out their money. They've already paid the chiropractor and they're expecting reimbursement from Medicare and from the secondary, and they have not received it because of, a lot of times the diagnosis wasn't done correctly, etc. So all of these are issues that we have seen that non-participating, not accepting assignment providers have. And so that is one of the reasons that we personally recommend for clinics to be participating providers with Medicare. Another common statement: Medicare only allows 12 visits for chiropractic services. The answer is there are no caps or limits in Medicare for covered chiropractic care rendered by chiropractors who meet Medicare's licensure and other requirements as specified in the Medicare Benefit Policy Manual. That was definitely a mouthful, But all visits billed to Medicare need to be medically necessary and meet Medicare documentation guidelines. And Medicare has never said that they only allow 12 visits for chiropractic services. It's just that with Medicare, of course, you need to make sure that all the care is medically necessary and meets the Medicare documentation guidelines. And you can refer to the MLN article SE0749, Section 1 of that article.